I've had lots of people who've come in and say, I've been just fatigued for 3 days. And it's really unusual. I examine, there's really nothing different. I do an MRI and they've got damage, new damage that's occurring. And I might treat that, even though I don't call it a relapse, but maybe if I could stop that inflammation, those fireworks of inflammation, maybe I could help them feel better faster. And it's possible that relapses leave some residual. We say a relapse, you get better. Not necessarily, and not always. And even when you get better, there's so much silent part of the brain. There's still damage going on there, and that accumulates over the years as you get more than the progressive phase of the disease, because the brain is being destroyed, even though I'm not recognizing it as a neurologist as well as the MRI recognizes it. I'm not suggesting that every time people are fatigued they should get treated, but when they're having something different, new, whether it's maybe it's cognitive problems, you know, their memory's just gone bad for a couple, 3 days. Talk to your doctor about that. Don't say, well, it's just MS, I'll get over it. I'm going to see him in 3 months. I'll tell him about it in 3 months, because in 3 months they won't remember it, and they won't talk about it, and there'll be other things to talk about. And the doctors are often focused on the disease-modifying therapies to try to reduce the number of relapses. And so therefore having those relapses leading up to that may not be quite as important in that conversation in a limited time with the doctor. And I'm saying it is important to talk to your doctor. It's very scary to wake up in the morning and your right leg doesn't work. You can't go to work, you can't get the kids off to school. You're saying, is this the beginning of the end for me for multiple sclerosis? It's a very scary business. And that's why you need a support system within the medical side that can help put that into perspective for them and at least evaluate the possibility of let's try to treat that weakness in that leg so that within 2 or 3 days you'll be up walking again. And if not, it may take weeks for this to recover. Every patient's an individual, every patient has individual needs, and they need a support system. And the doctor, it starts in the doctor's office with the nurse and even the clerk and the doctor saying, we care about you, this is important, I'm glad you're here, we can talk about it. Let's look at the options. This is a serious issue, and we need to treat it as a serious issue. So I'm really glad you made that phone call and came in to see me.